Paget's disease, okay, the fibrous supply of ground glass appearance. Paget's disease will have irregular bones, trabeculations, vertical, coarse trabeculae, diagnosed pregnancy. Okay. Question number 12. The posterior triangle on the neck is also Paget's disease in the hip joint. Posterior triangle of the neck is divided anatomically into the supraclavicular and occipital triangles by which structure inferior belly omohyoid. Posterior triangle of the neck is divided anatomically into the supraclavicular and occipital triangles by which structure inferior belly omohyoid. Question number 13. Patchy low density in the deep white matter with marked generalized atrophy and multiple small well-defined areas of low density which lack mass effect. HMPAOS can reduce purpurine to the severe prior to temporal coordination bilaterally, most likely diagnosis. Most likely diagnosis, a mixed pattern of Alzheimer's, GLB type, and vascular dementia. Generalized atrophy is Alzheimer's disease, and small low density areas is vascular dementia. Okay. CT scan shows patchy. Now the thing is Alzheimer's disease. Generalized atrophy means Alzheimer's disease. When a patient has marked generalized atrophy and diagnosis Alzheimer's disease, and when small low density areas is seen, then vascular dementia. Generalized atrophy is Alzheimer's disease, and multiple small well-defined areas of low density. Then so diagnosis is a mixed pattern of Alzheimer's disease and DLB type vascular dementia. Correct. Next, question number 14. A 42-year-old smoker has right arm weakness and left side proptosis with a contrary left pupil, where is most likely appearance of the carotid arteries, luminal narrowing on the left. Now, because Horner syndrome is on left, so double luminal aortic dissection. Okay. Since the patient has Horner syndrome on left, it says that 42-year-old smoker had right arm weakness and left side proptosis with contrary pupil, so he has Horner syndrome on the left side, so it's most likely due to the narrowing of the left carotid artery. Now, in the other option, there is double lumen, but it cannot be double lumen because double lumen of the carotid artery is usually seen dissecting and does not cause Horner syndrome. So there's luminal narrowing on the left side of carotid arteries. Right, question number 14. Wait, if you look at the answer, 14. The most common site of extracranial intracranial carotid artery dissection is the segment of vessel just distal to the carotid bifurcation. The most common finding in angiography is that of a tapered luminal narrowing and associated with enlargement of the diameter of the dissected vessel. So the most common appearance of the carotid artery is luminal narrowing on the left. These are ways of dissection or dissection. Next, question number 15. History of chronic schizophrenia for which he received medication. The recent onset of tremor and apathy. The scan shows bilateral, comma-shaped tracer uptake in the striatal pathways. The scan shows ill-defined low density in the periventricular deep white matter with a mild degree of atrophy. For most appropriate diagnosis, drug-induced Parkinson's syndrome. He has a history of chronic schizophrenia for which he uses medication, and then after that you do a DAT scan which was bilateral comma-shaped tracer. So diagnosis drug-induced Parkinson's syndrome due to the drugs we took for schizophrenia. Correct. Next, question number 16. Investigated for hypercalcemia. Whole body scan shows marked increased diffuse tracer uptake in the appendicular skeleton with increased bone to soft tissue ratio and absent renal uptake. Pain film shows speckled soft tissue calcification, or sound shows small low reflectivity lesion posterior to the right lobe of the thyroid gland, or sound shows small low reflectivity lesion posterior to the right lobe of the thyroid gland, most likely explanation, hyperparathyroidism, secondary to parathyroid adenoma. Okay? This is low reflectivity lesion posterior to the right lobe of the thyroid gland, hyperthyroidism, secondary to parathyroid adenoma, right lobe, and small low density lesion. There are features of hyperparathyroidism, paper pot skull, rugged dirty spine, and spine and brown tumors. Question number 17. A 55-year-old woman is being treated for hyperthyroidism using iodine 131. How soon after it is injected should imaging be performed? 24 hours. Remember that iodine has a high half-life of about 8 days. 8 days. So since it has such a long half-life, uh, so how soon after iodine is ingested should imaging be performed? 24 hours. How soon after iodine is ingested should imaging be performed? 24 hours. At least 1 day. Imagine. Question 18. Trauma to the nasal bridge and upper maxilla. Preferential factor passes through the middle wall of the orbit through the nasal lacrimal groove. It's just here. It's describing the fourth factor 3. This cancerous factor passes through the middle wall of the orbit through the nasal lacrimal groove and ethmoid bones along the floor and lateral orbital wall to the zygomaticofrontal frontal suture junction of the endozygomatic arch, where parts of the fracture extend to the ethmoid and vomer regard plates to the base of sphenoid So what type of factor is it? Default 3. Default 3. It is describing this factor, default 3. Correct? Number 19. Right side tripart fracture. How many McGregor lines are disrupted? 3. Next, again says here tripart fracture. Let's remember that tripart fracture consists of fracture of a frontal bone, maxillary bone, and cheekbone. So in that, these 3 McGregor lines are disrupted. All 3 McGregor lines are disrupted in right side tripart fracture. Similarly. Tripart fracture is also called complex pyramidal. The cyclical complex fracture, also known as quadripod or tripart fracture. Zygomatic maxillary complex fracture. So in zygomatozygoma, and it's a fracture in which the zygomatic and maxillary bones are involved, and frontal bones